في محاضرتين نفس اللي أخذتوها العام الماضي في level 1 أو surgery 1 اللي هي Peripheral Arterial Disease والvenous disease ما فيها تقريبا اختلاف. المحاضرة الثالثة هي about vascular emergencies. Vascular emergencies include acute limb ischemia برضو أخذتوها أنتوا السنة اللي راحت. And to another topic ما أخذتوهم اللي هي Carotid Artery Disease and Abdominal Aortic Aneurysm. حنبدأ بالبريفرال Arterial Disease. زي ما شرحنا لكم السنة اللي راحت. This is just about physiology and anatomy of the vessels or arteries. زي ما انتم شايفين تذكير سريع. Difference between the vein and the arteries in the histology. All of them includes 3 layers, but the artery is thicker than the vein because the media has more muscle, and also the veins has valves. What is atherosclerotic disease? It's actually a chronic inflammatory disease affects the inner wall of the artery, characterized by inflammation of intimal fibrofatty plaque. زي ما انتم عارفين, atherosclerotic disease can affect coronary arteries, cerebral arteries, carotid arteries, and also peripheral arteries. طبعا atherosclerotic disease, when it's affect large arteries like aorta, it might cause complete occlusion, which lead to ischemia, or also cause aneurysm and lead to rupture. And if it affects small arteries, definitely will cause occlusion and ischemia. Risk factor of atherosclerotic disease, as you know, as any atherosclerotic disease اللي هي كلها نفس الريسك فاكتور سواء coronaries ولا carotid ولا peripheral. You can classify it في many ways of classification. The easiest and best way هي non-modifiable and modifiable and minor risk factors. The non-modifiable اللي هي age, male gender, post-menopause, female, genetic abnormalities. الموديفايبل 1 اللي هي 4 الأشياء المشهورة المهمة: smoking, hypertension, diabetes and hypercholesterolemia. Minor risk factors في أشياء مثل sedentary lifestyle, obesity, stress, type A personality. كل هذه work as a minor risk factors or extra factors. زي ما شرحت لكم من شوي, atherosclerotic disease is a chronic process that can affect any artery in the body, especially coronary arteries and lead coronary disease and MI, or cerebral arteries to lead to CVA and stroke, or abdominal aorta or peripheral artery and lead to peripheral artery disease. So لما أجيكم أقول what is peripheral arterial disease, simply you have to say it's just atherosclerotic disease affecting the peripheral arteries. لما أقول لك إيش coronary artery disease, it's atherosclerotic disease affecting the coronary arteries. إيش carotid artery disease, atherosclerotic disease affecting the carotid arteries. They are simply atherosclerotic disease, which is a chronic process affecting the peripheral arteries of upper or lower limb. طبعا هي more common in the lower limb. So treatment in general for this peripheral arterial disease, it will lead to what? It will lead to decrease in the blood flow and chronic ischemia. This chronic ischemia might end up to critical limb ischemia زي ما حنشرح بعد شوي. So treatment usually we start with lifestyle modification or risk factor modification, كويس, and with medical treatment with antiplatelets and statin. And then we go for, if the patient has real ischemia and you have to revascularize, we go for revascularization either with open or endovascular. With endovascular with balloon, يعني angioplasty or stenting, or open with an endarterectomy or bypass. So بشكل مختصر التريتمنت نبدأ على حسب symptoms or clinical feature of the patient. If the patient has زي ما حنقول بعد شوية just, for example, asymptomatic peripheral arterial disease or mild symptoms like claudication, usually we start with risk factor modification and medical treatment اللي هي antiplatelet and statin. لما يكون البيشنت has more advanced clinical feature and mean symptoms and sign, ويدخل في critical limb ischemia, then we have to do revascularization either with endovascular or open. طبعا احنا it's a chronic peripheral disease, again it's a chronic disease, leads to stenosis secondary to plaque enlargement of the artery. Then because it's a chronic process, there will be collaterals will come in and open and help supplying the limb. طبعا the most arteries can be affected in the lower limb اللي هو superficial femoral artery مع popliteal artery. This is the most common. Also aorta or iliac disease can be affected. Tibial artery can be affected as well. So 20 to 50% of the patient has the peripheral artery disease but asymptomatic. 40 to 50% atypical pain, 10 to 35% عندهم intermittent claudication, and only in 1 to 2% عندهم critical limb ischemia. What is critical limb ischemia? It's the same, it's a peripheral artery disease بس يوصلون لمرحلة يكون عندهم very advanced presentation or clinical feature like wrist pain or ulcer or gangrene. What is intermittent claudication? You have to remember intermittent claudication, vascular intermittent claudication is different. So you have to know three things, very important. So in general, it's pain in a group of muscle. This is the claudication. Aggravates by exertion and relieved by rest. So if this pain affects the lower limb, كويس, and aggravate by exertion, يعني walking, and relief after 2 to 5 minutes of resting, this is typical vascular intermittent claudication. لما يكون الستينوسيس, as I said, most commonly في femoral artery or superficial femoral artery or popliteal artery, so the muscle group will be affected in the claudication is the leg arteries اللي هي calf muscle. But لما يكون الستينوسيس higher in the iliac artery or the aorta, the muscle group will be affected is higher, the thigh and gluteal area. So knowing the exact group of muscle or the location of pain is very important to locate the affected artery. critical limb ischemia زي ما قلت لكم لما يجي المريض بكريتيكال limb, متى نقول عليه critical limb ischemia؟ لما يكون عنده more advanced clinical features اللي هي wrist pain. wrist pain يعني pain at rest all the time, mainly when the patient lie down. Where is the location of the wrist pain? Usually at the foot, the most distal part of the body, the forefoot, لأنها أقل منطقة يوصل لها الدم. فلما المريض ينام على السرير حتى effective gravity يروح فيزيد البين. لذلك those patients usually they sleep while they are sitting عشان effective gravity. Also if the patient has ulcer يعني tissue loss or gangrene, كل هذول يكون عندهم نسميهم critical limb ischemia. It's different from acute limb ischemia اللي حقولها لكم في المحاضرة اللي بعدين. Acute limb ischemia is different. This is critical limb ischemia is still a chronic disease. It's not acute, but وصل المرحلة advanced. واضح؟ Taking history from the patient is important as well. زي ما قلت لكم claudication location or the group the عفوا. So knowing where is the location of the pain is very important to locate the arterial disease itself or the location of the arterial disease. So if the pain in the leg or in the calf muscle, that means the stenosis or the occlusion in the superficial femoral artery or popliteal artery. Whereas if the stenosis in the common iliac artery or distal aorta, so it will be higher. The thigh will be affected and the gluteal area will be affected. And also in the male patient, they will have some sort of impotence because the pelvic supply will be affected. So there is some sort of disease, we call it Lariat Syndrome. It's characterized by bilateral limb claudication and impotence and absent or diminished ephemeral pulse. Arterial ulcer is a feature of critical limb ischemia. Usually the arterial ulcer هنشرح إن شاء الله في الclinical session الفرق between the ulcers. Usually the arterial ulcer affects the most distal part of the foot اللي هي usually the toes and usually painful, ischemic, and with sharp or square cut edge. Sometimes get infected as well. So for evaluation of peripheral artery disease, you have to start with the history or physical examination, which we will discuss in the clinical session tomorrow, inshallah. Then you go for the diagnostic testing. For the diagnostic testing, طبعا هذا هنشرحها بكرة. Usually we have for diagnostic testing something called non-invasive وعندنا شيء اسمه minimal invasive and invasive. So usually we start with the non-invasive. احنا عندنا a lot of non-invasive vascular studies that can help for diagnosis and also for location or locating the problem or the stenosis. We have ABI اللي هي ankle brachial index. We have segmental pressure. We have duplex ultrasound. So ABI, as you remember from the last year, is simply as ankle brachial index. So it's the pressure in the ankle divided by the pressure in the brachial. Then the result will be an ABI. So usually the normal ABI is 1. So we accept from 0.9 as well until 1.3. This is normal. If it's below 0.9, that means there is decrease in the blood flow. There is difference between the upper limb and lower limb. So there is decrease in the blood flow. So between 0.4 and 0.9, this is mild to moderate. Usually those patient symptoms only claudication. But if it's below 0.4, that means they have there is a significant peripheral artery disease. Usually اللي عندهم below 0.4 they have critical limb ischemia, either ulcer or gangrene or wrist pain. طبعا لما يكون الاندكس above 1.3 it's unreliable. Usually we don't take it have a false reading because it's not compressible, and especially in diabetic patients their arteries, peripheral arteries become very calcified. فالكف machine حقت blood pressure won't be able to compress the artery to read, فيعطينا false reading. Also, there is something called segmental pressure. It's simple, just that you measure the pressure in the whole lower limb, upper thigh, upper leg, lower leg, and you see where is the difference. For example, if it's 120 upper thigh, 120 lower thigh, and then 90 in the upper leg, that means there is something in between the artery. So you just it just gives you an idea about which artery, which level يعني of what is the level of problem of the what is the level of the stenosis. Then we go for the duplex ultrasound. وتتذكرون السلام الماضي برضو شرحت لكم ايش الفرق بين الالتراساوند لحالها والدوبلكس والدوبلر. الدوبلر is only sound نسمع فيه. الالتراساوند is only ultrasound. Ultrasound is anatomical زي الابdominal ultrasound. It's just show you the anatomy يعني the artery itself. زي في الابdominal ultrasound نشوف الجول بلادر، نشوف الكدني. Duplex means duplex ultrasound. Duplex هذه means Doppler plus ultrasound يعني anatomy plus physiology. What does that mean? That means, as we see in the left side of the picture here, this is complete, this is only ultrasound, color ultrasound, show you the artery, very nice, common femoral with superficial femoral, profunda femoris, there is no plaque, no stenosis, كويس. It will give you an idea about the anatomy. You see if there is an occlusion, if there is a stenosis, reduce in the lumen, but will not give you the exact function. Whereas with Doppler, we can put the tracer here in the artery and see the velocity in the artery, inside the artery, and from that we can detect or know if there is a stenosis or not. طبعا with physics, if the velocity goes up high, that means there is a stenosis. If the velocity goes very low, almost zero, معناته في occlusion. So duplex, it's combination of anatomy and physiology, combination of ultrasound and Doppler. Then we go in the investigation for something called more or minimal invasive اللي هي CT angiogram or MRA. هي عبارة عن MRI or CT with contrast. Will show you exactly the location and the severity or the disease itself in the artery. Then we go the last stage for conventional angiogram, which is the more invasive one that you have to puncture the femoral artery or radial artery or brachial artery or go in to the target vessel with wire and then catheter and inject a dye there, the contrast, and see where is the problem. طبعا only diagnostic هذه now is very rare. Maybe before 20-25 years there was no other modalities, they just do it for diagnosis, but now we do it if we think that we are doing some therapeutics procedure. يعني والله أنا سويت duplex ultrasound, I found the stenosis in the superficial femoral artery, which is most likely will be opened by balloon. Then I don't go for CT angiogram, I go for angiogram to confirm that the diagnosis, and at the same time, because I know most likely I'll be able to open it, I do treatment. واضح؟ Treatment of peripheral arterial disease. So as I mentioned at the beginning, it depends on a clinical feature. If the patient's symptom is very mild symptom with only claudication, usually we treat it with conservative management. We ask the patient to stop smoking, which is very, very important. Modify the risk factors, all of them, control the blood pressure, hypertension, and also take antiplatelets and statin, and walk. We put him in a walking exercise because the walking will open more collaterals. So exercise 40 to 60 minutes for 3 times a week is very, very important. It will help a lot to open more collaterals and reduce the symptoms. Also, smoking cessation is very important. It will triple the claudication distance if the patient stops smoking. لما البيشنت يكون عنده critical limb ischemia, either gangrene or tissue loss or wrist pain, so usually those patient has ABI less than 0.4, and those patient needs revascularization, as I mentioned at the beginning, with either endovascular or open. Diabetic patient, actually, if the patient has diabetes and also has peripheral artery disease, actually they are the worst, unfortunately, because most of the arteries get affected with diabetic patient are tibial arteries, and you know the treatment of tibial arteries is the most difficult because they are small arteries and you cannot do bypass most of the time, that you just try opening them by balloon. طبعا هنا options of treatment. You don't have to go in details, either endovascular or open like here. Here is aortobifemoral bypass. Here is FemPop bypass. This is just like a summary. Lower extremity peripheral arterial disease is a marker for heavy systemic atherosclerotic disease burden. Treat risk factors. Primary treatment for claudication, usually exercise, stop smoking, يعني conservative management. If you have limb-threatening ischemia, which is critical limb ischemia, we have to do revascularization.